East Cheshire Hospice was founded 30 years ago to provide specialist palliative care. It was founded by local people who were determined that our area should have a hospice like other areas had. It was funded by local people and local businesses with a donation from ICI Pharmaceuticals covering nearly a third of the initial cost. Over the last 30 years we have provided the highest quality end-of-life care. We know this because every day our patients tell us, and we develop our services to meet their needs. We've opened our Sunflower Wellbeing Centre to provide support for patients and to give carers that much needed break, which in turn enables patients and carers to feel they can manage at home for some time longer. We've developed services to support patients dying with and from dementia, introduced new services for children, families and carers, improved our inpatient facilities, and now deliver new outpatient services such as blood transfusions. We currently provide care on site at East Cheshire Hospice for 500 patients a year, supporting around 2,500 family and friends of those we care for. But the demands of end-of-life care still move on, and people are now living for longer. For instance, the average life expectancy in some areas of East Cheshire is over 90. We know that for most people, longer life unfortunately brings failing health, and often the people that we care for at end of life have 3 or 4 long-term conditions that they are living with. Our work is therefore increasingly more complex. There are many organisations working to improve end-of-life care, and there's a wealth of guidance and policy documents, including the excellent End-of-Life Care Ambitions publication. All this work is designed to ensure that the care provided supports the individual and improves their end-of-life experience, and that they are able to die in a place of their choice. We know that most people want to die at home, but currently only 49% do so, and in fact 42% still die in hospital. This is not the choice of many, and we really need to do something differently if we are to address this. So where is the current system failing? There are 2 main reasons why we are not able to fully meet the needs of our local patients. Firstly, we are not able to provide the support and services required out of hours, which is that period between 6:30 at night and 8 o'clock each morning, every weekday and all weekend. This actually accounts for 2/3 of the week. There are lots of agencies and NHS staff around during the normal working week times, but limited resources in this out of hours period. The second reason is that the system, our health and social care system, is not able to respond quickly to the changing of circumstances. So for example, if an elderly man at the end of life is cared for by his elderly wife and has a crisis out of hours or during the night, they may be visited by one of the out of hours doctors or district nurses, but they are unfortunately unlikely to have sufficient time to enable the patient to stay at home feeling well supported through their crisis. The likelihood is that this patient will be admitted to hospital, and what's more, it may take 4 or 5 days to get that patient home again, even if the emergency has been dealt with. So what is our solution? We want to develop a second hospice, this one in people's homes. We want to create an East Cheshire Hospice at Home team that can respond rapidly to support the patients to enable them to either stay at home or get back home. The team will be made up of trained nurses and support staff, and they will be based at the hospice but will spend their time supporting patients in their normal place of residence. We hope to be able to support an extra 250 patients per year for about 1/6 of the cost that it takes to support the 500 patients per year we currently care for in our hospice. Our team will work with the other already well-established services and agencies, but we will have more time to support the out-of-hours nurses and doctors. We are hoping to create a team that will be available to respond when others can't. The funding we need to deliver this service is around £440,000 per year for the next 5 years. This money will enable us to recruit and train sufficient staff to meet the local needs, and we are seeking to raise this money from extra companies and local individuals in the area. 30 years ago, our founders were determined to create East Cheshire Hospice. Now we have a similar challenge. to create East Cheshire Hospice at Home. And the reason why I know so much about all of this: my name's Sarah Dale and I've been a specialist palliative care nurse at East Cheshire Hospice for the last 10 years. And in the past 6 months I have been researching the need of our local community and planning the East Cheshire Hospice at Home service. I know the difference a hospice at home will make to so many patients and their families. Join me in changing the face of hospice care forever in East Cheshire.